pain relief is supposed to be complex. And I said, it can't, no, math is complex, right? And so I said, there's got to be a way to break through steps. And so when we started looking at what you're doing and I'm doing when we're having success versus when we're failing, what step are we missing? What are we doing? And it doesn't mean we heal everybody, but we began to get to a process that we realized that so the umbrella of rehab pretty much falls under the core principles I showed you. You're moving them, they're moving themselves. Right. In the area of injury, not in the area of injury. Into restriction, not into restriction, which would be ease. What body area? 3 body areas. And then it's in standing, sitting, kneeling, on all fours, belly, back, and sideline, the whole human developmental sequence. From there, I can turn that over to somebody. How? I simply say to them, let's test a couple motions in each of the body parts, 3 body parts, arms, trunk, legs. Good. Let's test the area of injury. Good. Let's score it somehow. We've got a little scoring mechanism, 1 to 100 we use. Then let's treat it either by start with a twist because it's in the middle of the body. Do the opposite of yucky. Traditionally, usually did yucky. They just did yucky. We said do the opposite of yucky. Or do anything that's in symmetry that feels good, not sucky symmetry, but good symmetry. Right. Or to pick any yummy motion in your entire body. Those are things that there's no jargon in that. Right. I can put anybody through because I believe that if we can give somebody a recipe for chicken noodle soup and teach them something, why can't we figure that out within our own system? It's because we were looking at things incredible. We were looking at, should we go forward, backwards, side, outside, across, instead of saying, hey, we're going to restriction or not restriction. And once we realized it was kind of binary world, right? Hot, cold, everything is. Simplify. Yes. So if you can simplify the complexity that we placed on top, now all of a sudden, majority of patients can go through this and do really, really well, because the only thing that we do, we give them a basic 6 motions. And then when they get through that with the understandings of those 7 rules, then we show them, okay, now instead of doing your arm with this, we're going to rotate it in, which does something different on the joint. We're going to rotate it out. There's nothing else to do. Right. The joint can be in neutral, rotate in and rotate out, right? Then it can be in different positions. So right. When people see that, they go, oh, that's kind of crazy, Tom. And they do have a hard time shifting, but they don't say it's crazy as bad. They say, that's going to take me time to digest it. Right. I don't have to lay my hands on somebody. We'll have people that have been out years. I was 100% manual therapist, laid my hands on people constantly. All of that was pretty much, I did everything. I've had that to that degree. But I had a patient say to me once, they said, Tom, and they knew my background as a teacher. They knew that I was kind of struggling a little bit with the profession, because I got to a point that I think if people are watching this, you get to a point as a clinician that you go, I help this group of people. I'm not helping this group of people, so I got to go learn something new. Yeah. And you get into this cycle of what's wrong with me. So it kind of gets maybe some downers for you. And I felt like I'd taken enough classes that what's happening. And this patient said to me, they said, Tom, how good are you at fixing your patients? I puffed up my chest and I said, top 10% in the country. He didn't bat an eye. He then said, Tom, how good are your patients at fixing themselves? Right. I like that a lot. Isn't that cool? And it changed. That's the right way, because it's like, I'm only there for a minute and you're there the rest of the week or 2 weeks doing your energetic thing. And that is programming your system. Yeah, that's where the power is. Get them to square up and understand how to move differently. There's something about, you got to be able to give them the knowledge so they can take the responsibility to do it, so they can control it. And up to that point, Mackenzie did a really good job of handing things over. Feldenkrais, yes, does a really good job. That I always said at Feldenkrais maybe started with just 5 motions. A lot more people would know about it, but it's just a beautiful system. And then what I did said, what's the 80% we can throw out and the 20% we can keep to get people beginning something and having a very simple concept. So, it used to be, we just said, you can't do this, and this one feels good, just do a bunch of that. And that would just be shortening from the upper level, not the middle level or the lower level. And they get it, and 60% of the time that would change them.
It's pretty impressive. So it's like it goes to a Pareto distribution. 20% of the emotion will cure 80% of the problems.
Correct.
And it's like you teach them that part first, and then go forward from there, because it's like you're getting the low hanging fruit, I guess, is the easy answer.
Yeah, and most of it is, like, I was talking with a therapist yesterday, and he goes, "But Tom, when they get stuck, I want to jump back in and treat them." I go, "Well, there's a difference." I said, "I'm not a treater, I'm a teacher. And you've got to lose that mindset." So I said, if you walk into your practice and you're thinking, the reason you're thinking is because you don't believe that the routine that is set up, the routine can be stronger than you. And I was saying, for example, what was it with the protocol that they have for surgery, where they have the checklist, or the airplane, the pilots have to check off. Prior to that, people felt what they knew was better statistically of a result than it was. And what it took 20, 25 years to incorporate some of those things into some hospitals, right? That they were getting 78% success rate versus 92 with the protocols. And that's what I look at and go, okay, so I need to change that person's mind to believe in the routine. There's not many paths that have been laid out nicely without people squirreling all over the place.
I hope you enjoyed this episode of the Best Medicine Podcast with Bradley H. Werrell, DO. Don't forget to hit like and subscribe below, either over there or over there. Also, if you're interested in a medical consultation with myself, there's also information below.